Hello, I am Dr. Ethan, and in this video I will explain you what not to do to keep your shoulder healthy. Prevention is always better than therapy. Knowledge is the key for the above, so please keep watching. First of all, you must understand the shoulder anatomy. In this image you can see several anatomical structures, but the most important in our case are the following: the acromion, the head of the humerus, the supraspinatus muscle and its tendon, and the subacromial bursa. Particularly as for this small structure, the subacromial bursa, it lies here. It is a closed space like a small pouch or small bag with collapsed walls. In normal conditions, normally it is empty, but in case of injury or inflammation, this space fulfilled with fluid, which is painful condition. The shoulder is surrounded by 4 muscles running from the scapula and attached to the humeral head. And all of these give the motion and the rotation to the arm. This group of muscles is called rotator cuff. The most important and more sensitive muscle prone to injuries is the supraspinatus muscle and its tendon. This is another view from the above. Please pay attention to the space between the acromion and the head of the humerus. This space is very narrow, and through this space runs the tendon of the supraspinatus muscle. And please remember that that's the point, because this tendon passes through this very narrow space, which is like a small tunnel. The most important is that this narrow and small space is reduced further, as you see in this image, in case of abduction and rotation of the arm or abrupt movement, particularly abrupt abduction and rotation. Many people rotate their arms for several reasons and during several activities, for example during dancing, during warm-up in the gym, during exercise, or even as they do some sport. And now I will explain why this habit is the most disastrous motion for your shoulder. This is because during rotation or abrupt abduction, the supraspinatus tendon is trapped between the 2 bones, as you see here, the acromion and the humeral head. So injury of the supraspinatus tendon is inevitable, and in this case the tendon literally smashed and progressively damaged. As a result, the individual suffers significantly from pain, which is sometimes excruciating, and at the end stage of a chronic injury, the motion range of the shoulder is significantly reduced. The tendon gets progressively thinner and weak, and sometimes breaks, and in this case the condition is called supraspinatus tendon tear. Remember that with a torn supraspinatus muscle you cannot raise your hand. As a secondary pathology, the subacromial bursa, which is here, gets inflamed and fulfilled by fluid, and in this case the symptoms are getting worse. In conclusion, the most catastrophic motions of the shoulder are the rotation, the abrupt abduction, or combination of such motions. Keep in mind that the thin and sensitive tendon of the supraspinatus muscle is passing through a very narrow space, which is further reduced in case of wrong motion. You must remember some golden rules. First of all, never overextend your arm rapidly. Never rotate your arm extensively. In case of pain, keep your arm still and reduce the shoulder motion as more as you can. Never try to overcome your pain by extensive and pointless motions. Remember, it gets worse. Keep in mind that even minor injuries in the shoulder takes a long time to be cured, even months, so be patient. Don't forget that in case of chronic pain, particularly if it is not associated with injury, you must ask your doctor's opinion and advice to rule out any other underlying serious or rare disease. Be smart and think before you move. If you found this video useful and informative, please put your like and subscribe so you can get more information in the future from my channel. Thanks for watching.